all the times when you went to all the doctors, the thing that's the overarching thing is they all make you feel it's your fault that they're not working. You don't realize until it's almost not too late, but you don't realize that that is like the worst feeling ever, that they make you feel like it's your fault. It's not a medical problem. It's like, well, we can give you all these things to do, but obviously you're not doing them properly, because if you were, you would be thin and your life would be better and the world would be kittens and puppies.
This is Fat Science, a podcast dedicated to the science of why we get fat. No diets, no agendas, just science that makes you feel better. This podcast is for informational purposes only and is not intended to replace professional medical advice.
I'm Dr. Emily Cooper. I've been treating patients with metabolic issues for over 25 years. I'm on a mission to raise awareness about metabolic dysfunction and why diets don't work.
Hi, I'm Andrea Taylor. I've been fat, very fat, chubby, morbidly obese, and done almost every diet ever invented. They all worked until they didn't. I've known Dr. Cooper forever, but when I became her patient and we learned metabolism was the real problem, wow, everything changed, and I've never been healthier.
And I'm Mark Wright. It's time for Fat Science.
Wait, does this podcast make me look fat?
Welcome to Fat Science. I'm Mark Wright, along with Andrea Taylor and Dr. Emily Cooper. It's so great to see you two. Welcome.
Great to be here.
Hello.
All right, on the show today, how to talk to your doctor about metabolism. This is such an important topic because I think a lot of times, Dr. Cooper, when we talk to our physicians, we don't come to that conversation with a lot of confidence because we don't have a medical degree. We haven't been seeing patients. And sometimes whatever they say, we say, okay, I guess you're the expert. But today we're going to get some really healthy tools on how to engage as a patient when it comes to your own metabolism. And this is information that can have a profound impact on your health. So Dr. Cooper, it seems like for decades, as long as we can remember, doctors have told their patients, who have weight problems, that it's because they lack self-control or they're just not exercising right or they're eating too much. So why don't you set the baseline for the discussion when we go to our doctor and there's obviously something wrong? How should we approach our doctor when it comes to understanding our metabolism?
Well, the hope is that you'll have a good conversation with your doctor. That's our hope. And it's good to be aware, though, if it's not going in a good direction and if you feel like you're being blamed or not believed, or if this is happening to your child, for example, in an appointment, if you're being dismissed, blamed, not believed, that might be a situation where it's not worth the fight. It might be time to find another provider, actually. I just want to put that out there because our hope is that you will have a good discussion with your provider and that you won't get that kind of pushback. Years ago, when I started doing this, I know what it was like because I personally wasn't affected and wasn't going to a doctor with these problems, but I was a doctor trying to talk to other doctors about it. And I was just shocked with the degree of, just I don't want to call it anger, but it felt like anger, from these other providers who really didn't have a lot of knowledge in metabolic science, no familiarity with the area. So when you're trying to explain to them, no, I've recommended that this patient should not be on a diet. I don't want them to, be restricting their carbohydrates. And I don't want them to do that many hours of exercise. And this is all because I want them to be able to balance their metabolic system. I got so much pushback from these doctors and to the level of, being yelled at, hung up on, outright rudeness. This was, of course, over a decade ago. It may have been even 2 decades ago. I mean, this has been going on for a long time. Now we're in a different kind of environment medically, where we've kind of crossed some of the hurdles of accepting that there's metabolic dysfunction that's driving obesity. It's still a little bit like, well, it's still quite a bit in the past. It's not really fully engaged with the science at all, but at least you can have conversations now a little bit more, and there seems to be a little bit more curiosity and a little bit more openness. So one thing I would do is, and Andrea is an expert too in communication. Andrea actually helped me learn how to communicate with doctors and people in general in this topic. It's very tricky. But so I will let Andrea say something soon. But what I think is, when you're speaking to your doctor, is to just kind of say, what could be going on metabolically that is causing this underlying problem, this symptom of obesity? What could be going on? Is it, because I don't eat differently than other people, or whatever, diets haven't worked. You kind of tell it your history. Um, and even if you have a really crazy irregular appetite and you're like craving sugar all the time, or you're just never satisfied, bringing that up too, as reporting that as a symptom of a metabolism problem, not of a flaw or something that is causing the obesity. That is really a symptom. So when you talk about it, you can kind of use that terminology a little bit more and see where it's going. But I'm a big believer that primary care docs should be really at the forefront of this. Um, there is an obesity medicine specialty now, and I took that board exam the minute it came out, which was it was I think 2012. And now people are just getting certified right and left in that. And but I don't think you necessarily need an obesity medicine physician to help be your ally in it. But if you do have access to someone that has an obesity medicine certification, that might be helpful. And those are doctors who are either internal medicine or family medicine trained. And then they go on and get an extra certification in obesity medicine. So that might be good to look for someone with those credentials, because then they're a little bit more in tune with the science, and they've been to maybe some of the conferences and where they talk about the hormones and things like that. But if you don't have access to that, trying to develop a dialogue with your primary care doc, who should be your ally, is probably the first place to start. And trying to just say, well, let's figure out like what could be the cause, what could be a good positive treatment, um, what will be your role, what will be my role. So those are just some basic introductory ideas.
I'd love to talk to Andrea about that communication advice in just a sec. But I think at the heart of this, Dr. Cooper, as a patient, we first have to somehow identify whether our physician knows what they're talking about when it comes to metabolic science. Because if they don't, it's going to be, we've heard the stories from Andrea over and over, just eat less, exercise more. And it just, so I guess what I would love from you, Dr. Cooper, is like, what are some red flags that we should just really be looking for? That if they say this, this, or this, we should just say, okay, I'm going to go see somebody else, and no hard feelings, but thanks.
Yeah, and if I give you like what are the red flags, it'll exclude almost every doctor, unfortunately. Oh, I wish it wasn't so. But the advice for low carb diets, I mean, I'm sorry, that is just not the answer. But you're going to get, if you get that and that's the answer, you just need to go on this low carb diet and take this injection. That is not a good sign. But unfortunately, it's so widespread that I do struggle with understanding, how to advise people. But I think just being strong and just saying, I'm not going on a diet. I refuse. I mean, I have done that in the past, and all that happened was I lost weight, yes, and then it came back and more. And I did it again, and I did it again. I've done them all. I've done enough of that, and I'm not going there anymore. What else can happen here? And honestly, it does kind of leave me a little bit concerned for people out in the world, and what they're going to encounter. But I think
Mhm.
that you have to stand up to it. And sometimes I've heard that when people do that, the doctor themselves says, well, yeah, you're right. They don't work. You know,
I think that's the first thing you have to
yeah.
do. If the first instinct of the doctor is to hand you something that's like a pre-printed pamphlet that is a diet, or a pre-done thing that is not just for you, that's the first indication
Hmm.
that this is not going to work, because it's like what we used to say, this is not a potato chip problem, this is a metabolism problem.
Yes.
This that
I love
is
it.
that's like your key thing. It's like, this is not about the food. This is about my metabolism. And it was like, I think that that was one of the first things that I learned when I came to you, and it was the first thing that set off like such, it wasn't even a light bulb, it was fireworks in my head when I learned that was one of the first things. And then when I learned that it was a medical problem and it wasn't me, and that it was that the brain was involved, it was like my head was spinning, because I had always been told that it was me doing something, and that I was in total control of what I was doing wrong. And then when I learned that, oh, there's stuff that can help me, that like outside forces can help me fix it. Um, that was like, no one had ever told me that that could happen. So if you can help, if a physician can work with you to say, like, if you can tell them it's my metabolism that's a problem and I need you to help me not fix it, because you can't fix it, even though I've always said to you, can't you fix it? And you go, no. And then, but we can help it. We can help make something better, and we can work. I mean, look, this has been 12 years and I'm not done.
Mhm.
So this is not something obviously that happens overnight, but a lot is way better. And so many things that were messed up in my body are not messed up anymore. So it's kind of amazing what can happen. But you need to work with somebody who kind of knows what they're doing and understands what's going on inside your body metabolically. And as you've told me, in the medical books that, doctors go to a lot of medical school for,
Mhm.
this is not one of the subjects that's covered.
Yeah.
So you can't be totally angry at every doctor out there, because it's not totally their fault. But what I think is really interesting is when you bring it up at an appointment, hey, they may go read up on it.
Hmm. Yeah.
I mean, they could buy your book and look it up, and
Well, we actually,
Yeah.
I
yeah.
mean, I did that. I brought the book and said, "Look at this and help me. Like, this is what I'm doing, and I need you to go through it with me."
Yeah.
And we should say that the book is
Yeah,
Metabolic
the
Storm, right,
metabolic
Dr.
Oh, yeah.
Cooper?
storm. Yeah, the metabolic storm, science of your metabolism and why it's making you fat
Mhm.
and possibly infertile.
Yeah.
And that, but I haven't, I haven't updated it since 2015, but it's still pretty relevant.
It's
Mhm.
still really
Yeah, it's still
relevant.
relevant. But I also have a training course for doctors too through the Diabesity Institute, which is
Oh,
our
yeah.
nonprofit. And so we do have a level 1 and level 2 training for providers that's virtual. Um, so if somebody has a provider that's actually open to that, that's a really great course. And it really dives into understanding the metabolism, just the landscape of it, then seeing in action how different treatment strategies can be applied. The thing about it, and Mark has brought this up before, is that no two people are alike, with metabolic problems that lead to obesity and lead to prediabetes and diabetes. No two people are the same. So it's really important to really look in depth at what is really the root underlying causes that you can identify, and then set up a targeted personalized treatment for that. But Mark has brought up before that the treatment can change. It changes along the way to continue to make these improvements and to adapt to kind of how the disease process has morphed. And so
Yeah.
that's really important, because what we're seeing now are like a real simplified version of, obesity as a disease. It's so simplified. It's like, what other disease could be that simple that all you do is you give a person a diet and an injection? I mean, that's just not realistic, that is going
Yeah.
to end
Yep.
up solving the problem for the multitude of people. You may see short term changes, some people more than others, but in the end, you have to really look deeper at what all the little mechanisms are. We don't have medicines today that can correct just anything that it could possibly be that's behind, that's driving this. I mean, it's just like any other disease, but we don't treat it that way.
So, Dr. Cooper, if there's a provider listening, or maybe a patient who wants their provider to check out the training that you have, what's the best way to get in touch with
The
you?
best way is my clinic website. It's coopermetabolic.com. And on that, there's a resource tab. And on that, it shows, it's called the Metabolic Masterclass, level 1 training. And so you can access it there, and also on the diabetesInstitute.org site. Um,
Hmm.
or you could just send me a note on LinkedIn or through the podcast. I think there's a way to submit uh, a note if you have a provider that you want us to send info to, but
Mhm.
to potentially join that class. And it's a fun class. It's really good. It's very honest and authentic. Like, the providers there really talk about a lot of the obstacles and barriers, and a lot of, their struggles with treatment, because the problem is providers too want to feel good. It's not just the patients. The providers are also very frustrated that everything they've been told to tell patients doesn't work, and that they know it doesn't, and so they're told to tell the patients to follow this diet, follow this exercise, and then it's really not rewarding when the patient goes through all those steps and doesn't make long-term progress. So there's a big level of dissatisfaction among providers too in this area. They want to learn more, and they need more tools, and so that's what, through the Diabetes Institute, our goal is to increase access to effective science-based care for people
Hmm.
suffering from diabetes. So that's kind of along our mission. But but yeah, I think it's the passion that a provider might have is good. If they're passionate about it and they're like curious and they admit what they don't know, I would stick with that provider versus somebody who's kind of thinks they know everything and just doesn't
Yeah.
have any interest. Because if you have that passion and curiosity, as Andrea said, you can research, you can look, you can find information that will help your patients.
Yeah. And earlier, when I said, what are the red flags that we
Yeah.
should look for? My experience, and I think maybe this is good general advice, find that physician who is curious and open minded. And if they're open minded, because when I went to my family doc, I was pre-diabetic. So my blood pressure was high, my blood sugar was high, I had insulin problems. Um, it was bad. Um, Cholesterol, high cholesterol. And his advice was try to eat better, try to get more exercise. And that was the same advice over and over and over. And I started to see Dr. Cooper. And then when I'd go back for my annual exams, he said, "Hey, I would really like to see the blood work that she's looking at." And so I brought in the labs, and he looked at it, and then he looked at me and he said, "Honestly, Mark, I have no idea what she's doing." But he said, "If this is working for you, I encourage you to keep doing this." And I thought, man, that took a lot for someone who spent probably 30 years as a physician to be able to tell a patient, "I don't really know uh, about this, but it seems to be working." And that open mindedness. Andrea, did you get any of your
Yeah.
doctors who were kind of curious about it in the
My
beginning?
my the one GP that I had that I love, she was very similar. She's like, "I wanna see all the tests that Dr. Cooper's doing because 'cause they're really fascinating to me. I love seeing what's going on. It's really
Hmm.
interesting. I don't know what they all are, but it's really interesting, and I love seeing the progress that's happening because I don't know how to fix that. I know that there's a problem, and I believe that you're doing all the things that are right, but I don't know how to fix that." and I'm glad that you're doing the right thing.
Mhm.
And she always wanted to know all the updates. She wanted me to feed her all the blood tests. She wanted all the blood work, and she would, look at everything that was happening. But she didn't know that just wasn't her thing. She
Hmm.
didn't know how to do all that, but she wanted to know everything that was going on always.
Well,
Yeah.
yeah.
Same, and my gastroenterologist, same thing. She wanted to know everything that was happening,
Yeah.
but none of them understood what was going
Well,
on.
the collaboration is really important with all the providers. So I try to send updates to doctors or coordinate things, because a lot of our patients too might have kidney disease or cardiovascular disease, and we're coordinating a lot of other services with other providers. And it's so much easier nowadays than it used to be to try to explain this, justify why you're doing what you're doing when it wasn't known, because mainly there's just this huge gap between what is out there in metabolic science literature, which has been there for many, many years, versus what's being applied clinically. This enormous gap exists. It's unbelievable, actually. It's like a 20 year gap at least. Um, so at least it takes that long for established science to actually reach patients. It's I don't know why. I think a lot of it has to do with acceptance. Acceptance. The medical school curriculum is really hard to change. So that's one thing. Is young doctors being trained aren't it's not being imported into their current training for so many years, and then they're out practicing, and that's one of the problems too. But I think when it comes to obesity, there's an added resistance about it. Um,
Right.
and that is so demonstrated in how the world now is trying to embrace GLP-1 meds in this
Hmm.
bizarre, dysfunctional way. I mean, that you wouldn't with any other medical condition. So that's just
Yeah.
another aspect of that.
I think that a lot of doctors are very success oriented. I think that they all want to be, um, at least, a lot of doctors that I've visited over the years, my patients have all lost over 100 pounds. My patients have lost 80 pounds. My patient, they want to tell you when you've gone there that that's what's happened. Like when I went, I think I've talked about this before. I've had a gastric sleeve put, is it
Yep.
right? Gastric
Uh-huh.
sleeve, that's what it's called.
Mhm.
So, I mean, the surgeon that I went to who did the gastric sleeve, that's what he talked about. My patients have all been, my surgeries have been very successful. They've all lost X amount of weight. You will lose probably this amount of weight. I'm like, well,
Yeah.
they didn't talk about your metabolic function and your this and that. That's not where they were.
Mhm.
It's all about success, concrete numbers. That's what they talk about.
Well, the sad part is that they don't really have the numbers. I mean, they're telling you numbers, but very few doctors actually are really tracking that data. And you can tell, like, if they're very sensationalized numbers, like all my patients, this all, if you hear the word all, that's not true.
Exactly.
Yeah,
Hmm.
And it's not long-term numbers. It's
exactly.
all
Yes.
instant
Right.
numbers. It's not like, have they kept the weight off
Yeah.
for 10 years? Have they kept the weight off for a year?
It
Like,
does,
Yeah.
that didn't
it
track.
does oversimplify it quite a bit. That's a common problem.
This would be a perfect spot, I think, to read an email that Dr. Cooper got from Sarah in the Cincinnati area. Dr. Cooper is, she's a big fan of the podcast. She's reading your book. And she says, I'm so grateful to finally see that I'm not crazy and that there are actually medical professionals who, quote, get it. Her question, Dr. Cooper, is how do you find a provider like you in her area? Her primary doc is prescribing Wegovy. Her weight loss has stalled after about 20 pounds. She has about 100 pounds more that she wants to lose. She would greatly benefit from working closely with an expert, but she doesn't know how to find one. So, Sarah, thank you so much for listening to the podcast and for the question to Dr. Cooper. I think that's probably a very common thing, Dr. Cooper. You talked about physicians who are now prescribing these weight loss drugs, but it doesn't sound like they're doing any labs to see how the total metabolism is reacting, right?
Yeah, and it goes back to how what Andrea was saying with maybe they're not doing that because they might not feel secure about understanding which labs could be helpful, what to do, how do you know if they're abnormal? And when it comes to metabolism, it's kind of like looking through a prism. You really want to see corroborating evidence from various different angles. So that's why I tend to like to get a lot of labs to show, yes, I see this here, and then we see this here, which reinforces that that really is not just a fluke or something, that there really is something going on. And so you look at through a lot of different angles, looking for patterns and looking for relationships of not only levels of things in the body, but signaling, effectiveness, and things like that. So that can be pretty complicated for doctors that don't really know any of that science. And so, but there are some basic things that doctors have heard of that could be really helpful. For example, insulin. Most people, know, okay, measure my glucose and my HbA1c. That is important. But also, what is the insulin doing in conjunction with the glucose? That could be a really helpful test to see in the fasting state, but it's not enough. You need to also look at after you eat what is going on with the insulin and the glucose after you eat a regular meal. So, because they're most likely in a person like Sarah, what's happened is there's more to it than just putting a hormone in that mimics your GLP-1 to try to reassure your brain that you have enough food supply. That's all that the GLP-1 is doing. There's more to it. Just doing that alone and not dieting, which is a good idea, um, that just isn't enough to overcome whatever the dysfunction is that's there. And we don't know what it is. But one next step could be to kind of ask your doctor, would you be willing to do insulin levels to look at those? Now, then you get into this sticky point where do they know how to interpret the results? So, there is that. But if you're trying to get to the root question of what's driving the obesity, that's the key. Because if you don't get to that, maybe you'll get lucky and you'll just, be able to hit something that the person's going to respond to just in the dark. But we don't like to shoot in the dark. We want to find out more information and have a more kind of informed, therapeutic decision making going on. So I would say maybe trying to see if there is an obesity medicine doc in the area, or still have conversations with the primary doc and see, can we measure some more things? Like, how about insulin? Also, if you have that much weight still, and if you happen to have high weight in childhood, you might be a candidate for a free genetic testing program, which is called the Tempo Registry. It's short for tracing the melanocortin pathway in obesity. Melanocortin pathway is the brain pathway, and they look for 90 different genetic mutations within that brain pathway. And not that that's going to direct which medicine is going to work the best, but it can really bring awareness if there is something detected there to kind of the area of the brain where maybe the weak spots are. And it can be interesting for patients to find out like that if there is a genetic glitch there. But it is a free testing program. In order to qualify, you have to have a BMI over 40 as an adult, and you have to have had onset of elevated weight as a child before age 10 to qualify for the free testing. But yeah, and so it is a tough thing to know what to do next, because it normally it would be, well, you need a medical workup, just like if you had any
Hmm.
other disease. Like, but if you took a blood pressure medicine and your blood pressure is not responding enough, it started responding and now it's not, and now it's like shooting way up, and you're like concerned, well, is that because I have an irregular heart rhythm? Is it because I have an artery blockage? Is it because I have kidney disease? I mean, you're going to look further at what's driving it. But in obesity treatment today, it's been reduced. First, it was reduced to just the diets. Now it's reduced to the diets plus an injection, which is kind of the same.
But I think those are really good examples to use. The blood pressure example is a great one to use with a doctor to just make them go, "Oh, right."
Right.
Yeah. And maybe Sarah, forward the information to your physician to connect them with Dr. Cooper in terms of the training. It might be a good first step
Yeah.
to get that plugged into what Dr. Cooper is doing. Boy, that was a great analogy, the blood pressure, because in any medical condition, you want to get to the root, right?
You really do want to. And I'm very sorry if I'm not more helpful right now. I mean, I guess I am very grateful that we can even have these conversations now. That was not the case, you know, a while back. So now you can have these conversations, but I think you can stand up for yourself and say, I am not going to diet. Like, do not give me a diet. I'm, you know, eat nutritious food. Nutrition is a very important component of health. It just does not have the power to reverse this obesity in the long run. So I'll continue to eat nutritious food and take care of myself. But I need from my medical team to help me understand what the underlying drivers of this are and if there's any other medical treatment that would be worth pursuing.
I think as much as the Ozempic thing has sort of had a bad side of like people going, "Oh my god, she's on Ozempic, he's on Ozempic." I think it's also had a really good side of people opening up a discussion about obesity and understanding, "Oh my god, it's not just about they eat too much food, there's like another component to it. Like that there is more to somebody having a weight problem than just it being them eating a ton of food. There's like a medical issue there.
Hmm.
And I think that it's opened up a discussion for a lot of not just not just people who have weight issues. I think it's opened up a discussion for a lot of doctors to understand that it's a bigger issue than ever was thought of before. So I think that it will become a lot a lot more common to discuss
Yeah.
than it was before, sort of in the closet of like no one wanted to talk about
And
it.
you'll find these curious doctors that have a passion that are maybe they have gotten their obesity medicine certification and they are going to the conferences, which can be very scientific, where they have a lot of incredible scientific presentations that are very detailed in certain areas with certain hormones, certain players, with the metabolic system. So even if it's not telling them exactly how to create the treatment strategies, it's opening their eyes to how big the issues are and it's kind of perking their curiosity. And I mean, that's how I figured stuff out too, was just I had that passion and I just read a lot of research and you have to kind of piece it all together yourself to come up with something practical that is going to be applicable in a clinical way, not a research way, but a clinical way and effective for your patients. And so there's other doctors out there that have that passion that are attending those conferences, maybe in that obesity medicine specialty field. And so I think maybe trying to look out for that and trying to just look over their websites, make sure it's not like just selling you on a diet package and an injection. You know, there can be a lot of language that sounds good, but if you in the end see a meal plan, a diet package, just a monthly subscription for an injection, that isn't what you're looking for.
Yeah, I think if there's a package involved, I would be questioning it.
Well, this has been a lot of fun, you two. I think the big takeaway for me is just find that physician who's curious, who's open minded, and wants to work with you.
Yes.
And I think, physicians, like any other professional, they have a lot invested in what they believe to be their value, and that is what they know. So if you go to a lawyer, an accountant, anyone, they take a lot of pride in knowing a lot of things. But when it goes outside of their area of expertise, it's very uncomfortable for professionals to admit that they don't know everything that there is to know. So find that curious physician. If they say cut out the carbs or have this shake or
Run.
or just eat less, yeah, run. I think Andrea's advice is perfect. Well, this has been great. And just like our podcast, this is an ongoing conversation. So engage with your physician, have that conversation. Well, this has been another edition of Fat Science.
No diets, no agendas, just science to make you feel better.
I'm Mark Wright. Thanks for listening to Fat Science with Dr. Emily Cooper, a Work P2P production. New episodes drop every Monday. If you've enjoyed the conversation, subscribe, rate, and review this podcast. This production is for informational purposes only and is not intended to replace professional medical advice. Join us next week for another episode dedicated to the science of why we get fat. No diets, no agendas, just science that makes you feel better.